I started working with Second Sight in 2008, and I carried out my first implantation of the Argus 2 in 2009. I was certainly very interested in this technology, certainly for the treatment of blind people, people blind with perception of light vision only because of retinitis pigmentosa, because neither at the time nor today there's been any treatment that's available for this group of patients. So the possibility of restoring some central visual function for some visual function for these patients is certainly a significant achievement. And I was very interested in the technology and working with this company, which so far has proven a very successful association.
As an eye doctor, you actually want to give back sight to a patient. In general, we improve sight, but we do not give it back.
We really appreciate that we can help the patient in any way. These are blind patients, and any help for them to see better than light perception is by itself an achievement.
I've implanted 8 patients. 3 patients with retinitis pigmentosa, which have completed 7 years of follow-up, and 5 patients with age-related macular degeneration of the dry type that have follow-up from 5 to 15 months.
My experience is so far very positive. The implantation is longer than 1 year. The technical system works very well, and she's wearing it 12 hours per day. And every time I visit her, she tells me all the new things she can do.
The system works very well as a safety tool and implant. We don't see any adverse event, serious adverse event. And this number is not a small number. It's 10 patients and done by 4 surgeons from King Khaled Eye Specialist Hospital, competent surgeon. And then we really appreciate the support of the Second Sight group when they come to the hospital, give the surgical outcome an excellent surgical outcome.
Patients with retinitis pigmentosa have perception of light vision, so they can only see whether the light is on or off. If you imagine yourself as sitting in a room and closing your eyes, and somebody else turns on and off the light, and you can see the light that reaches your eyes through the skin of your eyelids, that's the amount of vision these patients have. It's vision that does not allow you to navigate, to find your way in a room. So if we can restore some visual functions so that the patient can find large objects in their way, can establish whether there is a large object in front of them, moving towards the right or to the left, see if there's somebody else sitting in front of them, that is something that restores some of the confidence in these patients, improves their quality of life. We have to remember these patients sometimes feel isolated, being in total darkness. So it is a significant achievement, in my opinion.
They will have a better life and higher quality of life, and that they will be able to do to communicate with the society again as a seeing person, which seems to be very important to most of our patients, and also that they have to be aware that they will learn a new way of seeing. And because these are all patients who became blind, they have been seeing when they were young, so they will not go back to what they did see before, but they have to learn a new way of interpretation of objects. She can find me, she can see the windows and doors at home. She's continuing her sports in a better way because she's bicycling, and she enjoys seeing the sunrise, and many other small things in her daily activity.